Hey guys, how's it going? So we wanted to talk to you about a procedure that I'm going to be getting done. I'm having surgery next week in Michigan, and I thought that this is a really good platform to talk about breast implant illness.
Yes, we're going on another trip.
Yeah,
Wish the circumstances were a little different, but it still counts, right?
it still counts. Well, for you guys. So I have been dealing with breast implant illness since 2019. I finally found out that it was the implants, and I'm 100% sure that it is them that's causing a lot of my issues that I've been having. It started in 2019 after the birth of my second child, where I noticed symptoms where at first I thought that, okay, maybe I should go see a doctor, and I did. I've seen plenty of doctors. I had plenty of physicals. All my blood work comes back negative. All my MRIs, which I had 3 MRIs, 2 CT scans, and a handful of ultrasounds, including many ER visits in Mexico as well. And I started researching, and I was really looking into why all these symptoms were happening. But I was looking at them in the States and as well in Mexico, because this was the year that I wanted. 2022 was the year I wanted to get them removed. And I know there's a huge waiting list for surgeons, plastic surgeons, that do these surgeries, that are capable of doing these surgeries, where they do a complete en-bloc capsulectomy, where they take out the implant, including the capsule around it, to make sure that there is no scar tissue and nothing left inside. And so these are some of the symptoms that I have been having, and this is just a few of the many that I have. I have a list of them. I'm not going to list all of them, but the 3 or 4 main ones that I've always had is brain fog, lack of energy, fatigue, and anxiety. And I have had anxiety previous to having my implants, but it definitely has been skyrocketing more after 2019. And at first, what's the first thing I thought? It was the thyroid. So sure, I went to go get thyroid tests. I went to endocrinologist. I saw my physician, everything cleared out. I'm like, oh my goodness, what's going on? So then I'm like, okay, let me go seek some therapy. Maybe it's something that I have to do to get, my mental health in check. And I was still having it, even though I went through therapy. I got a medication, I got off medication. And I'm not one to get on pills. I don't like to be on them if I don't have to be on them. So we decided to just take them off, and some symptoms subsided, some got worse. And so I just kept researching, and I finally found out so many videos, and I thank the community of women who go forward about their breast implant illness, and I decided that this is it. I gotta take them out. I do want to say that the FDA does not think yet that implants cause these symptoms. It is not FDA, approved. It's not recognized that it's silicone that's causing it, because so many other women have it and nothing happens. And there is no certain time frame that you get these symptoms. Some people get it 6 months after, some people get it a month after. I have them now, my silicone implants, for 7 years, and I am so ready to get them out. And not only because of my symptoms, I know it sounds weird, but I'd rather be smaller in cleavage. I don't find it attractive. So I don't want them anymore. So with that being said, I started looking, and I found several surgeons. I did many consultations. I did 3 consultations in Mexico. I did Zoom calls from plastic surgeons in California, Ohio, Illinois, and Michigan. And I originally found Dr. Chun, and I was super excited to go with him, as he is the #1 plastic surgeon that does capsulectomies. He only does explants, and it was extremely important for me to find a surgeon that does not do any implants and believes women that BII is indeed an illness. And so I found Dr. Chun, did the appointment, put in the deposit, but I had some mishaps at his office, not with Dr. Chun, but some of his staff wasn't the greatest at answering a lot of my questions. I felt like I was getting run down off the phone. They were just cutting me short. And again, there were other staff members that, jumped in and, answered because that certain lady did not have the time for me. So I figured if I'm going to be paying this chunk of money, I'm going to keep looking for a surgeon that possibly has nicer staff, because it is very important to me. I want to make sure that I'm comfortable and not like second guessing myself, because I'm already a nervous wreck getting these out. So I found a group on Facebook, and the doctor's name is Dr. Khan in Novi, Michigan. And that is the surgeon that I'm going with. Dr. Khan, his way is no drains. As other doctors, you need to have drains to be placed, but Dr. Khan does a meticulous way where he operates on an avascular plane, and he puts no drains in, and you're under twilight anesthesia instead of going under general, which was super important to me because I had several other procedures done and that were under anesthesia, general anesthesia, and I had issues, TMI, going to the bathroom after. So I think that I'm just scarred for life in regards to that, and so I'm really excited to go under twilight. Chris is sitting here listening to all this because he hears this day in and day out on how tired I am. There are times that I cannot, there is no way that you can wake me up in the morning. It's kind of scary.
Can I say something?
Yeah, sorry, because I just keep talking because I'm on a roll and I'm like talking fluidly, so I'm trying to finish here. All right,
I'd like to backtrack a little and go back to the process of choosing the right doctor and why we didn't go with the doctors here in Mexico, even though the price is about 50% of the cost of getting this procedure done in the United States, is because all these doctors here actually perform the removal procedure, but they also perform the implant procedure. And that tells you something that they either do not really take BII very seriously, or they are not very skilled and they don't have enough experience, because it is a very, very, very particular procedure where you really have to take the entire capsule out. Your body doesn't know what a silicone
it's a foreign object,
bowl is. It's a foreign object, and it's trying to get rid of it, right? So that's why you get all these different symptoms, because for your body there's no easy way to get it out, and that's why you get headaches, fevers, rashes, hives, all that stuff. So what's very important with finding the right doctor, and that's how we came to Dr. Chan or Dr. Khan, is these are the only two surgeons that actually performed that full en bloc surgery. They remove the entire capsule with the implant in it, and they make sure there is nothing left behind, so that you do not have any further inflammation, your body doesn't detect any of the dead tissue or anything, or nothing else is left behind, so that those symptoms actually go away. So
yeah, thank you for that. No, I totally forgot about that. As I was talking, I also did a consultation here in Mexico, several of them, and they were great doctors that do many other, plastic surgeries in different areas. But it was so important for me, again, to get that capsule and the implant out at the same time, and don't leave anything. I had a lot of doctors that were like, well, at least get the implant out, but your body will absorb the capsule. So that was a huge no for me. So then I went to Dr. Chan. Beautiful, #1 doctor, according to Google, in the United States to be taking out implants. But luckily, I was also able to find a doctor that I didn't even know that does twilight, and I don't need drains. And drains are a high risk for infection, but also the other part of it is that if you don't get drains, they say that you could possibly get a seroma, which is a fluid collection, if you don't listen to the doctor to the T. But like I said, Dr. Khan does a specific way to the way that he cuts during the surgery, and that's why you don't need the drains. It's a bloodless field, which you can look at all of his YouTubes and Instagrams and Facebooks. He does lives on how he does it, and he's done an enormous amount of surgeries for lots of women.
I find it amazing. I saw some of those videos, and maybe they're not very pleasant to watch. It's just that pure fact that he cuts the breast open and there is nothing, no blood in there. He will just show everything to you, and there's no blood coming out. So really,
Yeah,
no
it's
need,
awesome.
no need for
I mean,
drains. His
there was-
technique is amazing. It's very impressive.
There was a video where he's cutting it so slowly and like perfectly that you can even, he shows you like the heartbeat while he's doing the surgery. There's a video of that on his Instagram.
And that makes you just feel so good
Yes.
that you are in good hands, because there are so many other surgeons, as I said, that perform all kinds of surgeries, and we're not sure if they're about money.
Money
They just
makers,
wanna
right?
rush
They
through
want to
it.
do lifts.
Yeah.
That's another thing. Dr. Khan will not do a lift. He doesn't think that it's needed right away. The most important thing for him is that your body detoxes any toxins that you had because of the silicone or saline implants. So, for some reason, even though we were going to go with Dr. Chun, I'm glad that I also looked into other surgeons, and I found Dr. Khan, and we're so excited I'm nervous, but I'm excited to get this over with, because I am just so sick of being inflamed and bloated and lack of energy and always tired, and Chris telling me that you better wake up, and it's exhausting. So
well, it affects all of us.
Yes.
Both of us. So we have two
little
children,
pups.
Philip and Benji,
Yeah.
2 pups, and our hamster Chi-Chi. But it affects the entire family.
Yeah. Yes. And it's sad, because you really, when I looked at these YouTube videos, these women, they're really hurting. Like some people have it worse than me, and they're like really hurting, and so many people don't believe them, and they just think it's just lies, and their husbands don't believe them. And I'm lucky that my husband is here supporting me along the way, but it like brings me to tears. But yeah, it's so important to get your health in order. So the reason I'm doing this video is for those of you out there that have breast implants, and you are thinking that what's going on with me, and you've done many tests of other diseases that you think that you may have, and everything is negative. Think about the breast implant illness.
And I just wanted to add that Paulina is fairly young, and she hasn't had those implants for a very long time. They're not ruptured, and she already has all these symptoms that are really affecting her daily life.
Yeah.
And I can't even imagine what are women going through that have had their breast implants for 30 or 40 years even.
And Dr. Khan
And
does
they-
show that
and
there's
they are
women
in
with 40 years.
pain. They see psychiatrists. They go through divorces because the families don't support them.
Yep.
They go to see doctors, and the doctors don't believe in BII, so they just think that that they make those symptoms up. They go through all the tests, MRIs and surgeries, and it's not helping, and your life is just a disaster. So if you are watching this video and you haven't gotten your breast implants yet, don't.
Yes.
And if you do,
And that's-
and you're suffering, please consider taking them out so that your life quality can come back up.
Yes, it's so important. And but so many of my friends actually got they got implants after asking me how do I like them, and anybody that knows me, I always say I don't like them. Actually, I didn't really even like them after I got them, even though the surgeon did a wonderful job. I kind of missed my own breast.
What I'm angry about is that no one told us, or no
No,
one told you
back then.
about the possible side effects and the risks of getting the implant. Of course, my common sense thought so. Like, you're taking the silicone ball and putting it in your body. Even if you get a splinter in your finger, it hurts like hell, and you're trying to get it out. So I can't imagine what
body
you're
just
going through
rejects it.
when you're putting two
Yeah.
big balls inside your body. But everyone said that it was fine, right?
Yeah.
And now we're finding out that it's not. Thousands of women worldwide that actually now are putting the 2 and 2 together, connecting the dots. Finally, and still they get no support from the FDA. Just like the tobacco business, they knew that cigarettes were causing cancer, and they wouldn't tell anyone. I think this is exactly the same pattern.
Like Chris said, I'm young. I'm 32 years old. I had them for 7 years, and it's time to get them out. So next Thursday, I cannot wait for you, Dr. Khan. I'm coming for you. So thank you so much, and we will still continue to travel.
We have a lot of travel videos on our channel. We'll be making more, and that's one of the reasons why we decided to go with this procedure, because it really affects our travels. And we've had situations when, you know, we go on a trip, we have excursions planned or visiting different sites, and Paulina's waking up in the morning with a
Hives.
migraine or hives all over her body, and our trip,
Out of nowhere.
instead of visiting Mayan ruins, we're going to the emergency room, and I'm sitting with the kids. They're bored. You know, we're waiting for the doctor to see. She's getting shots. The hives go away. The next morning, we're going through exactly the same thing, and it just affects our trips and doesn't let us really enjoy our passion, which is travel. We want to travel to
Yes.
many places and show you the world. And
I always cross my fingers when I'm traveling. I'm like, what am I gonna get on this trip? What's gonna happen
What's
for
gonna
me
happen,
on this
yeah.
trip? So no, but what was the last trip that we had? We went to Oaxaca, and I had 3 emergency visits in 7 days. So it was scary. So again, if this video helps anybody, I hope it does, and that you're not alone in this. I have so many friends that I actually am really close with now, and that we speak post their surgeries, and they're telling me and they're cheering me on. So I'm super excited to get this done. Nervous as heck, but because it's like with any surgery, you're nervous, but I'm so excited to get better. Thank you for watching, guys.
we'll see you soon.
Adios. Hey guys, so we're on our way to Michigan.
Mama's going to get the surgery done.